welcome back to my YouTube channel. And for today's video, I'll be doing the What's in My Bag Challenge Student Nurse Edition. Let's go! So what I'll be showing you today, guys, is my Paraphernalia kit. A Paraphernalia kit, or Para-kit for short, is a handy bag that contains all the necessary tools and equipment that a student nurse must always have with them during their duties or RLE sessions. Okay, so here is my Para-kit. See, it's small, easy to carry, and it contains all the important tools and equipment that I need. Before I open this, just a disclaimer, the contents of my kit is based on the list of required tools and equipments that were given to us by our school. And so, if we're not from the same institution, there might be some stuff in my bag that may vary from yours. Okay? Okay. Now I am going to open my bag. Are you ready? I'm ready. Ta-da! So this is what the inside of my bag looks like. It has 3 smaller compartments and 1 main compartment here. And okay, I am going to show you the tools that I have one by one. Okay, so first I have my stethoscope. Okay, a stethoscope is used to listen for the sounds generated by the heart, the lungs, intestinal tract. So for the heart, we have our 5 critical auscultation points. We have the aortic, pulmonic, Erb's point, the tricuspid, and mitral. Also, for the lung sounds, we listen for the normal breath sounds, adventitious sounds such as crackles, rhonchi, wheezes, and also for vocal resonance. And then for the intestinal tract, we listen for borborygmi or gurgling sounds. Also, this stethoscope can be used in checking for a patient's blood pressure. Okay, so using this, we listen for the blood pumping through the arteries. Next, I have my sphygmomanometer. Okay, this is what it looks like. A sphygmomanometer consists of an inflatable cuff. This is what we wrap around the patient's arm, and then an aneroid gauge, and the bulb and the valve. Okay. Next, I have my retractable tape measure. This one is very cute. It's Thor. Okay, so this is used to measure the patient's body parts, such as the waist, the hips, the thigh circumference or leg circumference, and then fundal height. Also to measure the dimensions of a wound. So it's nice to buy the retractable tape measure so that it's easy to fix, easy to collect, and it will not get tangled inside the bag. Next one, I have here my calibrated medicine glass. So this one is used to ensure that when we administer medications that are in liquid form, we get the correct dosage, okay, because it already has the calibration here. So I prefer mine to be really made out of glass because it's transparent, it's clear, and it's clean to look at, okay? And the calibration does not fade. Next, I have my this one, it's called the pulse oximeter. Okay, this measures the oxygen saturation of the patient. So what you do, you just place the finger of your patient here, and then after a few seconds it will show the results in here. Okay, next I have my This one, it has my working gloves, also betadine wound solution. Okay, this one, it's not really required, but I just have it in cases of emergency. Okay, next one, I have my alcohol used to maintain hand hygiene, also used to clean the equipments that I use, or when I perform aftercare of the equipments, I use some alcohol. And then I have my bandage scissors. So this one used to cut bandages for dressings and drapes. I also have my forceps. This one is used for tweezing, clamping, applying pressure in medical procedures. Okay. And then I also have my micropore tape. This one is used to secure bandages and dressing to the skin. Okay. And then I also have my this one. It's my small notebook. This is where I jot down the results of my patient's vital signs, and I also write in here any important information regarding my patient's case. Okay. And then I also have my medicine tray. So this one, it's stainless steel. Whenever I go and prepare the medication that I need to administer to my patient, I usually line this with a cloth or paper towel so that the prepared medication or syringes or whatever won't slip off the tray. Okay, so we're done with the biggest compartment. Let's move on to the small ones up here. Okay, so first, this one. Okay, first I have here a sharpener. Okay, to sharpen pencils, of course. And then I have my 3 color ball pens. So I have the black, blue, and red. These are used for charting. Okay, so in some hospitals they require different colors for each shift, and sometimes also in other hospitals they use different colors in charting in the TPR sheet. And then I also have my ruler, small ruler here. This one used still for the TPR sheet when we do our graph. And then I have my pencils because in charting it's really a big no-no to have any erasures, and so as students who are still trying to learn, we have to use pencils first, and when we get the go signal from our clinical instructors to use the ball pen, then we can then transcribe the writing in ball pen. And then I also have my eraser and my padlock and key. This one is because during our duties we were given our own lockers, and so to secure our belongings, our bags or etc., we place them on the locker, and then we use our own padlocks and keys to lock the locker. Okay, and then let's move on to the second. First is this is my small calculator. See, it's very cute. It's small and it's pink. This one used to calculate drug dosages, IV calculations also. This is one I use this. This is to ensure that we administer the right amount of medication to the patient. Okay, next I have here my thermometer to get the temperature of the patient. This one is an axillary thermometer. Okay, we have to ensure that everything or every equipment that we have is working properly. Okay, next I have my pen light. This one is used to assess for the pupil response and pupil diameter. So I think it's especially nice because it has this, different sizes where we could compare the size of our patient's pupils, if it's still normal, or it's very dilated or constricted. Okay, and then I'll show you how it works. I have my batteries here. Ta-da! It's working. Next, I have here my nail cutter. This one is used to ensure that we as student nurses always have short, clean nails, because long nails are a site for the accumulation of dirt and microorganisms. Also, if we have long nails, when we use gloves, it tends to break because the nails are sharp and long. And then let's move on to the last part. Okay. Next, I have here my extra batteries. I have a sterile pad. This one, it's not required, but just in case of emergency, I have it. Next is I have the tongue depressors. This one is used to examine the throat and the oral cavity. I have here some extra face mask. And lastly, here I have my sterile gloves, surgical gloves, rubber latex, powder free. So I have here 2 pairs of sterile gloves. This one is used to prevent surgical site infection and reduce the risk of exposure to blood and bodily fluids, okay, to also ensure the safety of us healthcare workers. Okay, so that's all the contents of my bags, okay. There's nothing left, but just additional, as student nurses who go on duties, hospital duties especially, we are also required to bring with us, or to have with us, our we have here the Nurse's Pocket Guide, Diagnosis, Prioritized Interventions, and Rationales. This is really helpful, especially that when we go on duties, we are always required to make nursing care plans for a patient. So we have here the nursing diagnosis, for example, readiness for enhanced breastfeeding, and it also has some primary nursing interventions and the rationales for doing so. Okay, it's really helpful, especially that we are not allowed to use cell phones inside or during our duties. So yeah. And then we also have our nursing drug handbook. So this one is really important because before we go and administer medications, we are always asked to perform a drug study first to ensure that we as student nurses know what the drug is for, its what the drug is for, its indication, its contraindications, side effects, and etc. Okay, also so that when our patients ask us what the drug is for, we'll be able to answer their queries because we have already read it from this book. Okay, so that is all for today, guys. I hope you liked my video, and I also hope that this one helped for those who wants to enroll in nursing school, have an idea what they should prepare. Okay, so if any of you wants to learn how to use those equipments, such as in taking the vital signs of a patient, I also have a return demonstration video for that, so please check it out. If you like this video, please like, share, comment, and subscribe. Thank you all for watching. Bye!